Hello, I hope you watched the first part of our video on bladder cancer, and let's continue further discussing the treatment options for bladder cancer. If the bladder cancer has invaded into the muscle, the entire treatment changes. Radical cystectomy, which means the removal of the entire bladder, is the gold standard treatment for this particular stage. Bladder cancer, which is muscle invasive, can be quite lethal, and therefore an extended form of surgery is required in which the bladder, the seminal vesicles and the prostate are removed. The entire lymph nodes within the pelvis are dissected to look for any microscopic spread to those areas, and then a new or urinary diversion has to be created. This diversion may be of two forms. The simplest form involves a single tube of intestine to which the ureters are connected, and then it is brought out on the surface of the skin as a stoma. This is known as an ileal conduit. Today, almost 70 to 75% of patients opt for an ileal conduit because it is simple, easy to manage, and has a good long-term outcome. The other option for motivated patients involves the creation of a neobladder. This uses a large portion of intestine which is folded, and then a bladder is created out of it and anastomosed to the urethra or the urine passage. This is quite a complicated surgery. It takes almost 6 to 8 hours to complete, and there is a small minority of patients, about 5%, who may not be able to empty the neobladder properly, and therefore they need to learn how to catheterize themselves in order to empty it. Today, robotic radical cystectomy provides us a minimally invasive alternative to the traditional open approach. This is associated with less blood loss during the surgery, a more rapid recovery of the patients and discharge from the hospital, and also reduces certain complications like strictures where we join the ureter to the intestine. I was lucky enough to be a part of the first study comparing robotic versus open radical cystectomy for bladder cancer, and this was published in the Lancet, one of the most prestigious journals in the world, in 2018. We showed that there was significantly lower blood loss and an earlier discharge of patients who underwent surgery with the robotic approach, and without any compromise in the cancer control and the survival of these cases. An alternative approach in patients who are either unfit or unwilling for surgery is what is known as trimodal therapy or chemoradiation. In these cases, the bladder tumor is resected as much as possible through the endoscopic approach that we discussed, the TURBT. Following that, chemotherapy and radiation are used to provide local control of the disease. In certain selected cases like smaller tumors which are away from the ureters, it also provides a good alternative to radical cystectomy. Follow-up of patients with bladder cancer is also extremely strict. In those with non-muscle invasive bladder cancer, as we discussed, regular urine tests and cystoscopies are needed, and it is unfortunately one of the most expensive cancers a person can get because of these repeated procedures. Following removal of the bladder, we need to monitor both the control of cancer with regular imaging as well as how the patient has adapted to their urinary diversion by closely checking up on the conduit or the neobladder, as the case may be. These urinary diversions may produce certain metabolic complications, and therefore regular blood tests and checking of the patient's electrolytes, vitamin B12 and other such biochemical tests may be needed to assess the function of the urinary diversion. Certain complications may occur from the stoma itself in terms of parastomal hernia or a prolapse of the stoma, and therefore one needs to keep checking on the health of the stoma. For a neobladder, its emptying needs to be assessed regularly, and like we discussed, some number of patients may need to learn to catheterize themselves in order to empty it well. Neobladders are also associated with similar electrolyte abnormalities as a conduit may be. If you find this video beneficial, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.